Mpox is a disease that has garnered significant attention in recent years. It is caused by a virus, specifically the monkeypox virus. The virus is similar to the one that causes smallpox, sharing many characteristics. Mpox is not as deadly as smallpox, but it can still make you very sick, causing symptoms like fever, rash, and swollen lymph nodes. Mpox was first discovered in monkeys in 1958 during research studies. That's how it got its name, combining monkey and pox. But it can spread to people too, primarily through close contact with an infected animal or person. The virus is mainly found in Central and West Africa, where it is considered endemic. However, it has been reported in other parts of the world too, often linked to international travel or imported animals. Mpox is a serious disease, but it is treatable with antiviral medications and supportive care. If you think you might have Mpox, see a doctor right away to get the appropriate treatment and prevent spreading it to others. Mpox spreads easily from animals to people. You can get Mpox if you are bitten or scratched by an infected animal. You can also get it from touching an infected animal's bodily fluids. Mpox can also spread from person to person. This can happen through close contact with an infected person. It can also happen through contact with an infected person's clothes or bedding. Pregnant women can pass Mpox to their babies and can happen during pregnancy, labor, or breastfeeding. Mpox starts with flu-like symptoms, which can be quite misleading at first. You might have a fever, which can be quite high and persistent, along with a severe headache, muscle aches, and chills that make you feel very uncomfortable. You might also feel very tired, almost to the point of exhaustion, making it hard to carry out daily activities. After a few days, you might get a rash, which is one of the more distinctive symptoms of Mpox. The rash can look like pimples or blisters, and it can be quite alarming to see it spread. It can be itchy and painful, causing significant discomfort and sometimes even pain. The rash usually starts on the face and then spreads to other parts of the body, including the arms and legs. Mpox can be very serious, especially if not treated promptly. In some cases, it can be fatal, particularly in individuals with weakened immune systems or other health complications. The Africa CDC is worried about the spread of Mpox. They have declared it a public health emergency. This means that they are taking the outbreak very seriously. The Africa CDC is working to control the outbreak. They are also working to educate people about Mpox. They want people to know how to protect themselves from the virus. The World Health Organization is also monitoring the situation. They are working with the Africa CDC to control the outbreak. There are several important steps you can take to protect yourself from Mpox. These steps are simple yet highly effective in reducing the risk of infection. One crucial measure is to avoid contact with sick animals, especially in regions where Mpox is prevalent. Wild animals can be carriers of the virus, and direct contact can lead to transmission. Another essential practice is to wash your hands frequently with soap and water. Proper hand hygiene can significantly reduce the risk of contracting the virus. Additionally, it is important to avoid close contact with individuals who are sick. Maintaining a safe distance can help prevent the spread of the virus. Your healthcare provider can offer guidance on how to relieve your symptoms and support your recovery. Following their advice is crucial for managing the illness effectively. Consulting with your doctor can provide you with more detailed information and personalized recommendations based on your specific situation. Mpox is indeed a serious disease that requires attention and care. Understanding its impact and taking preventive measures can make a significant difference.